Okay, so good afternoon, everyone. I'm Shreya from Autism Connect team, and today I'm happy to have amazing early childhood educator and ABA therapist, Dr. Payal Shewani, on board with us. So before starting with this amazing session, I would like to give a small description about Dr. Payal. So she's a performance driven professional with experience of 20 years in teaching and development, performance analysis for preschoolers, organizational management, and people management. Demonstrated ability to communicate with and assist kids in order to facilitate their learning in a manner that supports child's development with interactive and encouraging programs that spurs them to willingly give excellent results. Continuously learning and demonstrating an in-depth understanding of techniques and concept which children are involved more and more in learning new things along with the play. Substantial experience in developing and implementing education's best practice and contemporary strategies that are aligned to organizational requirements. Proactively purpose innovative strategies that open up new opportunities for the growth and development of preschoolers. So I request Dr. Payal to continue with the session. All the best, ma'am.
Thank you. And first of all, good afternoon. And we are still in a phase of celebrating Women's Day, still the events going on. And recently, today is another event which I am arranging for Women's Day. And hats off to all the women who are autism moms, especially. They are special, deserving people and honored. So I wish you all a happy Women's Day. Let's start with the session. Today's topic is play-based technique to increase the sitting tolerance in autism. My name is Dr. Payal Shewani, an early childhood educator. To give you a brief about this, let's start our journey through this session. It is said that if a child can't learn the way we teach, maybe it's time for us to change the pattern, change the method for them to learn how they want to learn, to understand much better. First, let us understand what is play therapy. Play therapy is a physiotherapy in which the play is used as a tool, and it is helping children to express their views, to communicate with their feelings. It is not only that they are playing with a toy, or they are playing with any friend, or they are playing with any area or music or something, but they are actually giving their emotions to the parents, to the teachers. So first, let us understand what is play. Play is a therapy, and where children with autism can improve their social and emotional skill. It is very useful and very important for every child autism to sit and play and explore themselves with the social and emotional skills. It develops their social and emotional skills. It also develops their language skill, because at time when they are not able to express, they may bring you something what they feel. For example, if they are hungry, or if they are not feeling okay, they want to cry, to show the emotions, they are happy. So they will either give a little hyper kind of action, like, clapping loudly, shouting loudly, and so on. Think differently. It makes autism child to think differently. Obviously, they are not in a place to sit and do an activity as the other child is doing, but at least they will come to you and show their things in a different way. So when a parent or a teacher or an ABA therapist, when they come across this play therapy, it is easy for a teacher or a ABA therapy to understand what the child has to say. It extends the way the play and the relate to other people. They also can relate to other people by playing and by play therapy. This is a chart that shows how much a sitting tolerance does a child gives you when you sit and play, or when you ask them to do any activity or ask them to learn. So this is a chart. This is shows that 8 to 15 months old child can sit for 1 or 2 minutes. Second, 16 to 19 month child can sit only for 2 to 3 minutes. Now, what I did in a preschool, we made a practice. This is a very good example to share with you right away. Initially, when the child is coming to any play school or kindergarten, it is a pattern to give a warm-up exercise. After, when they are going back to home, we make them sit and ask them to do meditation. Now, initially stage, you will think like, 2-year child, how will they meditate and how they can sit, but slowly and steadily, when they realize, okay, before going home, it's really need to calm your body. The children used to sit at least for 3 minutes. So that is a task when we gave, and it was researched, and it gave a huge positive response in child's behavior as well, child's development as well. And they made a practice to sit 2 to 3 minutes before going to home. So that is a time when the body is really high. When they have done a lot of activities, they sit, they meditate, and this gives a sitting tolerance a huge aspect. And later they do the activity with more sitting tolerance time. 2 to 3 years old, 5 to 8 minutes. 3 to 4 years, 8 to 10 minutes. 5 years, 12 to 15 minutes. 7 years is 25 minutes, and 10-year-old kid is 40 minutes. So now 40 minutes, that means they are a good as per the school schedule time, the one lecture, they are supposed to sit and listen and do what is being instructed. If you see what does imply a sitting tolerance, or how to develop a sitting tolerance right from the beginning in our central nervous system, how it works. If you talk, it is the taste, the vision, the interoception, the smell, the tactile, the auditory processing. These all factors do impact a child's sitting tolerance. How? Suppose if you want a child to sit and eat with you on a dinner table, on a table to have a family time, but if the taste or if the things are not okay or not good as per the child's requirement or the preferences, he may not sit and he may get away. If the child is very conservative related to the likings of texture of food, he will not sit for a longer time. So before we want a child to sit on a table related to taste, we should be very much aware, the parent should be very much aware what my child likes, what are the dislikes. Awareness of two sides of body, ability to filter sensory input, integrate reflexes, motor planning, and body sema. Here it means that the child must be aware of using the two sides of the body, right and left. You need to aware a child, this is right, this is left, and how to use your body. Attention, language, eye and hand coordination, posture, visual spatial perception, daily living skills, behavior, and academic skills. These are all the things that are related to child's sitting tolerance and play therapy. When they sit, when we know these all things are being taught, or these all things are being given, and the child's sitting tolerance will keep on increasing. With further, I will show you now much more examples related to this in a video and as well as in pictorial form. Now, how to, when the parents say, it's okay to say the child is, we should make a child to sit, we should make a, how? So we are entering into this session. Create a distraction-free environment means when you want a child to sit and do, make sure the TV is not there, make sure the light is appropriate, make sure the smell of the environment is appropriate or good for the child to have a soothing form. The smell of the room also affect the child's attention, and it is distracted free. For example, if I want to teach a child to sit and write and hold a pencil, but somebody is talking, the phones are coming, the child will get distracted and he will not sit continuously. So make sure when you're doing an activity, when you want a child to sit, it should be a distraction-free atmosphere. When it comes to an activity or making a sitting tolerance practice in the initial stage, make sure that what a child likes, suppose child likes drawing, or what is his favorite toy, what is his favorite thing that he can sit and use as in sitting tolerance. So try to use that thing as reinforcers by his or her choice. And many children are like, you can see playing with fidget, playing with same toy, or playing with same wearing same kind of cloth. So such children can be given an activity based on that. How? Now here you can see it's a very simple and very home created activity, but then this activity brings lots of tolerance level of a child to sit in one place. This activity can bring them to sit at least for 10 to 12 minutes in one session. How? I will just explain you. This is level 1 and the child age is 2 years. Okay. It's a simple activity. The child is being learning to hold the bottle, to put the water, colored water, in glasses, but without spilling the on the ground. So now this is a task for the child, and it is in hand, eyes, and hand coordination. The child is trying to put the water, but it should not spill is his task. When the child learns to put how it is to be done, and slowly you can raise the intensity of the activity by putting a mark here on the glass and asking the child to put the water until that level. Now what happens is, once they are doing this activity, once they are okay what is to be done, the task giving or the intensity of task make them to sit and do more tolerantly this activity. Make a child very interactive and colorful, and make the child to sit and do the activity as per their choice. This is what we understand. But now how to make a child to sit and do the activity in a tolerance way? If you want a child to be self-dependent, here is how you can. You can see the child is given a choice to make from the cards. The child is selecting, this is a task what I will be doing. So the child select this as a task. The decision making power, okay, this is my activity, this is my challenge, and this is what I'm supposed to do. And the child will do it by themselves, because this is what they have selected, and give them a self-dependent and confidence level to do the activity, which again automatically relates to sit-in tolerance and sit and do for activity and complete it. You can see it's a critical thinking. The child thinks, the child copies. It gives exactly the pattern has to be done, the color. The activity should be such in which the child is interested, and the activity can also be given a prompt. What is prompt? Prompt means you are giving a physical prompt, visual prompt, or an oral prompt to the child to do or complete the activity. Here is a small and simple activity, but you will see that the child is engaging himself in, and so his interest is there in the activity. Again, a play-based method, concentration level, eye contact increases, motor skill. the water is finished, but he's still trying to put it more, like, so this gives an sitting tolerance. You can see the child is sitting and doing an activity nicely based, and he repeated the activity for a number of times. Like, this is another activity. What does this mean? When a child builds a tower, okay, it is coding. Coding means you are developing something. Okay, and purposely we give a practice of decoding it or breaking it or thrashing it down. But again, to bring a child's confidence, it has to be rebuilt. Again, the tower has to be built, and again, we have asked them, the child, to throw it back and again rebuild. What does this mean? What this activity means? This means coding, decoding, and coding. What is coding? Coding is to build. Coding is to build. Decoding is to break. Encoding is to redo it or rebuild it. Whenever we see that, it is initial stage of failure acceptance strategy. What does this mean? The child, whenever the failure is not being accepted, and the child gets disappointed, disheartened, but we need to make them understand it's not a place to stop at some time, but you need to redo it. So the child enjoys this activity, he builds it, trash it, and then again redo it. So it is coding, decoding, and encoding. And the activities, you can see, it could be really colorful. It could be really good. This child is only 2 years, but sitting and doing with a color pairing and pom-pom makes the child to increase the sitting tolerance. After the child understand what is an activity, how many times does a child should repeat the activity? The same activity can be repeated for at least 6 times. 6 times when you repeat the activity, the child actually understand the meaning of that. And to increase the tolerance, when you see the child is losing any interest, just increase the intensity. Just how to increase the intensity in this particular activity, I can show you. This is how we can increase. Now we can ask them, instead of a 5 cup, you can bring many tower, or many glasses can be on the base, and then the second layer, and so on. So once the child understands the activity, increase the intensity of the play by giving more task-oriented goals. This is how we can make them sit for more time, more patiently, and the children do it very nicely. And again, that it should be like, something very fun loving or fun giving, and it should be when a child's sitting tolerance is seen, also increase when they are in the group, when they are sitting around. So they see each other, they try to copy each other, they try to imitate each other. Okay, and they try to compete, like, mine is good, and they sit for longer time for one particular activity. Again, a sitting tolerance. Kids sit for a longer time when they are in a group. There are different types of play what you can engage. These are small simple activity which I showed you. Children sit and do for at least 10 to 15 minutes. Again, very interesting is pretend play. How to make them learn, make them a setup of any environment, whatever activities are there with you, make an environment, ask them to play the role of the character they are seeing. For here, you can see an example. It's a mall, and one child is going for a shopping. So you can increase the intensity, increase the level slowly and slowly. Once they understand they have to do an activity, they will automatically come and ask them, okay, let's do this, or let's go for shopping, and this activity. They literally done the setup, whatever the children have done by themselves, and they want to play, so they play. So giving play also is a very important part here. Do not give the toys randomly. Okay, these are the toys, and the toys are here and there, and it has no importance. So if you're giving a toy, give it with a purpose. The toy can be given when the child asks, okay, will you play with this toy? If yes, then let's go for this task. So give them decision power, give them a questionnaire. What is this? Ask them, and increase their pretend play. lesser doing the prompt level. When slowly the child understand, give them a prompt level should be decreased. How? Do not stop their creativity. Whenever they are doing something, let them do, let them play with the toys. Play is really very important role of a child's life. How? You see a helicopter was there and they wanted to build something on the wheel, so they had the simple toy, but they put the different toy pattern, that is block was there, and on this car they started building this tower. So it is now a tower on the wheels instead of an helicopter. This was their creativity. So I just wanted to show, do not stop their creativity, let them do, and you will see how the brain works. In our we always say, like, the sun is a circle. What, maybe we don't know this, they can make the sun square. Why not to give them a different perspective of everything and let them learn on their own? So here play is really very important. When the curiosity is image, when you see the child is very curious, and slowly and steadily the child will learn to sit for a longer time and explore things by himself. The child is trying to see why this two blocks are not falling down. These are some activities for the teachers or for parents, like, these are coding activities. These are some coloring. This is for their oral motor skills and developing speech delay. This is something, the drawing within participants for sustainable development goals. And these are some, again, a coding and differentiating activities for the children. And again, this is an blow or blowing activity. How you can give in a different way depends on you. So I hope I've covered your topics with lots and lots of examples. Yes, the sitting tolerance can be increased when you do it in a proper way. Ask the child, make an environment first, make a child to sit in a proper environment, distraction free. The smell should be good, the environment should be good. And if they are in a group, they will do in much more better way. So any more questions?
Okay. So thank you so much, ma'am, for sharing this wonderful information with our audience. And I hope our audience enjoyed this session a lot. Once again, I thank you so much for joining with us today.
Thank you. Thank you.